So my name is Caitlin. Today I'm going to be demonstrating an IV and intermittent drug admin via mini bag. So first I'd be checking over my physician's orders and making sure that everything matches on my MAR for my drug. I'm checking over my patient's charts, and so I've found out that my patient, Emma Wrightson, has come in with a infection from a cat scratch, so she has cellulitis on the left arm. So this drug, cloxacillin, is indicated for that condition. So I'm just going to go over my patient information. So I have Emma Wrightson. Her FIN is 123456789. Her date of birth is the 20th of October 1990, and her doctor is Dr. Nichols. So she has no known allergies, and I'll be checking to make sure that the MAR has been checked and transcribed by 2 different nurses, and it has. Okay, so I'm just checking on my physician's orders that I have a primary infusion of normal saline running at 25 cc's per hour, so I'll make sure when I go to the bedside to check for that rate. Okay, so I'm just going to perform hand hygiene before I start touching my med supplies. So I've already drawn up my cloxacillin from the Pyxis machine. So I'm going to do my first med check. So I have Emma Wrightson. My drug is cloxacillin, this is cloxacillin. It's a 750 milligram dose, so I have 2,000 milligrams in the vial, so I'll have enough to draw my dose. It's an IV med. It says IV on the bottle, and it's to be given every 4 hours. So I'd have 6 time slots marked here, and it's currently 1,200 hours, and this drug has not been administered yet, so I'm going to give it now. So I'm checking my bottle to make sure that it's not expired, and it's not, so I'm good to prepare this drug. So I'm first going to check over my information in my PDM. So my drug is cloxacillin. It's an antibiotic drug, which is indicated for my patient's bacterial infection cellulitis from her cat scratch. So it may be administered by a student nurse, so I'm okay to give it. The usual dose is 1 to 2 grams IV or IM every 4 to 6 hours. So we're a little bit below that, but that's okay. The maximum single dose is 2 grams, and we're well below that, so that's good. And so I have a 2-gram vial, so I'm going to be reconstituting with 6.8 mLs of sterile water for injection. My final volume will be 8 mLs, and I'm going to be using, or my final concentration will be 250 milligrams per ml. So I'm going to draw 3 mLs to get my 750 milligram dose. So for a 500 milligram to 1 gram dose, I'm going to dilute it in 50 to 100 mLs of normal saline. So I've got my mini bag here. I've selected the 50 milligram because my patient has a fluid restriction. I'm checking the bag, making sure that it's not expired, and it's not, so it's good to go. I'm going to administer it over 60 minutes just because my patient has never had this drug before, and I want to be able to monitor their side effects to the drug. So I'm going to give it over more time so that I have more time to do that. So this isn't expired, and I'm just checking, so I have my sterile water selected too, because that's what I'm reconstituting with, and this isn't expired either. Okay, so I'm just checking a few more things on my PDM. So my maximum rate's over 30 minutes. I'm going to be below that. My maximum concentration, once I've reconstituted, it's going to be 250 milligrams per ml, but it'll be further diluted in 50 mLs, so it'll be well below that. The compatibility, it's compatible with normal saline, which is good because that's what's in my primary infusion and what's in my mini bag. And I'm just going to be monitoring for diarrhea, nausea, and a hypersensitivity reaction, so I'll be asking her to watch for a rash. Okay, so that's my PDM. So now I'm going to start going over and setting up my meds. So I have my sterile water and my cloxacillin, so I'm going to clean the tops of each vial for 30 seconds. So 30 seconds has passed. Okay, so I'm going to throw that out. I'm going to open a new alcohol swab, and I'm going to clean the top of my cloxacillin. So 30 seconds has passed, and that's all clean. So both bottles are clean now. So I'm going to choose my 10 ml syringe to draw up my 6.8 mLs of sterile water, just because that's the most appropriate needle to pull out that dose. So I'm going to pull out 6.8 mLs of air to insert into my sterile water vial. Okay, so it's clean already, we're good to insert it. So there's my air. And I'm just going to pull out 6.8 mLs of water. And I'm pulling out just a little bit extra just to be able to tap out the bubbles. Okay, so I'm just going to use the swoop and scoop method to recap so I can tap out my bubbles. And I'm going to pull back and redo. Okay, so I have 6.8 mLs of sterile water. So my cap or my top is already clean because I already sterilized it. So I'm going to insert it into my drug because I have the right amount for reconstitution. And I'm going to withdraw my air.
I'll just see how far I get.
Okay. And I'm going to swoop and scoop and throw this syringe into my hazardous waste, or like my sharps container. So now I'm just going to recheck my reconstitution. So I used 6.8 mLs of sterile water in my syringe to reconstitute. I have now a final concentration of 250 milligrams per ml. So I'm gently going to roll it to mix my med. So that means I'm going to have to drop 3 mLs to get the 750 milligram dose. So I'm going to use a new swab because I probably touched it to clean it. So I'm going to clean for 30 seconds. Okay, so 30 seconds has passed. So now I'm going to grab a new 5 ml syringe to drop the dose because the dose is 3 mLs and I want to get as close to the amount as possible. Like I'm using a smaller syringe rather than the 10 ml syringe because it's only 3 mLs and I want to be as accurate as possible. So now I'm going to drop 3 mLs of air into the syringe, and now that it's been mixed and the top is clean, I'm good to insert my needle. I'm injecting my air and I'm going to pull 3 mLs of water.
It's due today and now, and it has not been given yet, so I will be giving the dose now. And the drug is not expired. And I'm just going to look at my PDM here. So for azithromycin, also known as Zithromax.
Okay, so I'm just pulling a little bit extra just so that I can mix my, take out my bubbles. So I'm using the swoop and scoop method to put on my cap, and I'm tapping the bubbles out. I'm withdrawing the bubbles from the top, and I'm making sure that I have the right dose. So I have 3 mLs. So just rechecking with the PDM, and that's what I want according to my MAR. So I'm going to write out my med label. So my patient is Emma Wrightson. So Emma Wrightson. The drug name is cloxacillin. It's an IV drug. My dose is going to be 750 milligrams. My volume is 3 mLs. My concentration per ml will be 250 milligrams per ml. And I'm not saying it's not will be when it's in the bag. I'm saying right now it's 250 milligrams per ml, so that I know that I have the right dose with 3 mLs. The date and time is currently October 22nd, 1200 hours, and I'm putting my signature KKUMSN3. Okay, so the rate, once I combine it with my mini bag, it'll be 53. So my total volume will be 53 mLs. So my rate, since I'm doing it over 60 minutes to watch for side effects, it's going to be 53 mLs per hour. So I'm going to be watching for diarrhea, nausea, and asking her to watch for a rash. Okay, so now that I made my med label, I'm going to do my second med check. So I have Emma Wrightson. Emma Wrightson is who this drug is for. So my drug is cloxacillin. So I have cloxacillin here and cloxacillin, and it's in my syringe. So I have, my dose is 750 milligrams, so there was 2,000 milligrams in here. Once I reconstituted, it was 250 milligrams per ml. I drew up 3 mLs in my syringe to get the 750 milligram dose. So there's 3 mLs in my syringe. So then it's an IV route, so it says IV on my bottle, and I will put this into my med bag and that'll go in IV. It's to be given every 4 hours. So on my MAR, this is my MAR. I'm just going to redo my second med check just because I was doing it with my physician's order, which is still right. But Emma Wrightson, cloxacillin, 750 milligrams. 750 milligrams here because once I reconstituted it, the 2,000 milligrams, it was 250 milligrams per ml. I drew up 3 mLs and got my dose of 750 milligrams, so that's the right dose. It says IV on the bottle, and it's IV. We're going to administer IV to be given every 4 hours. So one of my time slots is 1,200 hours. It's currently 1,200 hours, so we're going to give this drug now. So that's my second med check. Okay, so now I'm going to reconstitute, dilute. So I'd be grabbing a new alcohol swab, and I'm going to be cleaning the port on my med bag for 30 seconds. So 30 seconds has passed, and I'm going to insert my med. And I know that this is sterile because it was hanging over the table and it has not touched anything. So there goes my 3 milligram dose, or my 3 ml dose, 750 milligrams. Okay, and I'm gonna put that into the sharps container. I'm gently gonna mix this to make sure that it's mixed properly, and I'm gonna put on my label. So I'm gonna grab all my supplies. I'm heading to the bedside. Okay. So as I'm entering the patient's room, I'm performing hand hygiene. I'm doing my entrance safety check, making sure their bed's in the lowest position, the patient's not in any distress. I'm asking the patient's name. They tell me it's Emma Wrightson, and their date of birth, and they tell me it's the 20th of October, 1990. So I'm checking their wristband and comparing it to the MAR. I have Emma Wrightson. Her FIN is 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. So I know I'm the right patient. I'm asking the patient if they have any allergies, and they say that they have no allergies. So I'm just checking my primary rate, making sure that it's running. It was supposed to be going at 25 cc's per hour, and it is. Just checking for any bubbles, following the line down, making sure everything's open and running. Asking the patient if they have any pain, swelling, or redness at the site, and there isn't any, so it's good. So my site's been checked. So I'm going to do my third med check. So I have Emma Wrightson. My drug is cloxacillin. The dose is 750 milligrams. 750 milligrams on here because I had 250 milligrams per ml, and I reconstituted with, and I drew up 3 ml to get the 750 milligram dose, so that's right. It's an IV drug, it says on the MAR, and this is IV. I'm going to be hooking that. It's to be given every 4 hours, so I have 6 time slots. It's currently 1200 hours, which is one of the time slots to give it, and this med has not been given yet, so we're going to give it. So I'm going to educate the patient now. So this drug is cloxacillin. It's indicated for your bacterial infection, cellulitis. So this will help clear up that bacterial infection. It's an antibiotic to help with that. So this drug may give you side effects such as diarrhea, nausea, or you may have an allergic reaction such as a rash. So we're going to be monitoring for those symptoms. If you have any of those symptoms, let us know about them. So I'm asking the patient if they're okay to take this drug, and they consent and say that they will. So we're good to set it up. So I'm going to first start by lowering my primary. And I'm going to make sure that I'm being sterile with my technique to
alcohol swabs and my
connect it.
I'm just going to do
There
my
we
hand
go.
hygiene and enter the patient.
So I'm just going to close my roller clamp to make sure that it won't forward slide, and I'm going to just put it up there temporarily so that I can attach it to my port. So I'm going to grab a new alcohol swab, and I'm going to clean the port for 30 seconds. So 30 seconds has passed. I'm making sure not to put it down.
I'll be your nurse today.
So I'm going to attach it.
Okay, great. And do you have any allergies?
Okay. So now I'm going to lower my secondary to back prime. So I'm back priming my drug. Okay, so there's no bubbles or anything in here.
They don't have an allergy wristband, and they've
So now I'm going to open up all the, or I'm just going to program my secondary rate here. So I had 53 mLs per hour, and my volume is 53 mLs. I'm going to confirm secondary.
Side effects of this drug could be rash, vomiting, diarrhea. So if you have any of those, we can stop the infusion.
And I'm going to press start. So now it's running. I'm opening all my roller clamps. I'm checking to make sure that I'm getting 3 drips from my drip chamber. So I would just be checking to make sure everything's perfusing. I have all the clamps open, making sure that everything's running. Asking the patient if there's any pain as it's infusing, checking for any leaks, and it's okay. I would label my secondary to make sure that that people know when this has been put on, so when it needs to be changed. I'm going to document on my MAR. I'm going to put my initials, the date, and the time, and I'm going to mark the amount on my in and out record for the amount that I've infused. So as I'm exiting the room, I'm going to do my exit safety check. I'm going to be telling the patient I'm going to be returning to check on them, and I'm going to infuse a 15 cc flush in 1 hour once the drug has been administered. So I'm leaving, making sure the call bell's in reach, the patient's not in any distress, the rest of my exit safety check, and that's my demo.